This video presents an arthroscopic second fracture fixation in association with ACL repair and lateral meniscal suture. The patient is a 25-year-old male with a sprained right knee who underwent surgery 7 days after the accident. The radiographs show a second fracture, and the MRI confirms the diagnosis while looking for other concomitant lesions. The clinical evaluation showed an hematoma on the anterolateral side of the proximal tibia. The Lachman, the anterior drawer, and the pivot shift tests show an anterolateral knee instability. The exploration of the lateral gutter is performed with a scope introduced from the anteromedial portal. The shaver is introduced from the anterolateral portal into the lateral gutter to debride the tissue between the lateral cortex of the femur and the IT band. This step allows the identification of the ALL. Subsequently, an 18 gauge needle is introduced from the outside in between the Gerdy's tubercle and the fibular head by using the hematoma as a reference for the second fracture. The appearance of the intra-articular hematoma is used as a guide for further release of the synovial coverage until the bony fragment of the second fracture is finally identified. The lateral meniscus presents non-degenerative horizontal tear of the zone 2 mid-body. The suture is performed using an all-inside meniscal repair, all suture inserted from the anteromedial portal with the aid of a portal skid. A type 1 ACL tear is identified and probed. A femoral outside-in ACL guide is used to create a 3.5 mm femoral tunnel by using the femoral stump of the native ACL as a footprint. The two bundles of the ACL remnant on the tibial side are prepared by using two number 2 fiber rings. The ACL repair tightrope is mounted over the two ACL fiber rings. The femoral shuttle number 2 fiber wire is then retrieved from the anteromedial portal through the 8 mm passport cannula and is used to pass the ACL repair tightrope through the joint up to the femur. A standard ACL tibial guide is used to create a tibial tunnel. The internal braced fiber tip suture is then shuttled into the joint by using the nylon wire loop and is then fixed with an absorbable knotless Y-block. A 4.5 mm corkscrew anchor is introduced from the anterolateral portal and inserted through the lateral tibial plateau at the level of the second fracture. The avulsed distal ALL insertion at the level of the lateral meniscus is prepared by passing the 3 wires with a knee scorpion suture passer. The 3 anchors suture are then passed through the external margin of the lateral meniscus and knotted with a simple suture to fix the second fracture just below the lateral meniscus. The Lachman test is performed at the end of the procedure, and the clinical follow-up at 30 days post-surgery shows a complete range of motion and a good stability evaluated with the Lachman and pivot shift test.